Hello. Good morning, everyone. Thank you for joining us today. We're going to give it another minute here to let other folks join, and then we'll go ahead and get started with today's webinar. Thank you for being here. All right, so let's go ahead and get started. Again, thank you all for joining us for today's Walk Here's Conversations webinar. Today's topic will be aging in place. My name is Sebastian. I am the Outreach and Language Access Lead for the Walk Cares Fund, and I will be hosting today's presentation. I'm also going to take a moment here to introduce and meet our panel. So we have Stephanie joining us from Department of Health. She works as the Older Adult Falls Prevention Specialist. We also have Marcy with us today, Director of Health Aging Initiatives, also at the Department of Health, and Christina, the Associate State Director, Communications at AARP for Washington State. So really happy to have them all here, and they'll be speaking to their work and programs here for today's webinar. If you have any questions throughout the webinar, you are welcome to enter them through the Q&A function at any point in the presentation. Um, if we're unable to answer your question during today's allotted time, you're also welcome to email us your question through the Contact Us form on our website. You can submit your questions both if you're using a computer as well as if you're maybe on the Zoom app on your phone. Today's webinar will also be recorded. So the recording, along with the slides, will be available on our website, walkcaresfund.wa.gov/webinars, within 24 hours of the completion of today's presentation. So let's go ahead and start things off by defining long-term care. So long-term care is help with activities of daily living. That can be things like bathing, eating, moving around, and managing medications. It does not include medical care, so things like doctor's visits and treatment for medical conditions. Long-term care isn't just for older people. Long-term, it can also help a lot of younger people with a disability, an injury, or a severe illness. And a lot of people think long-term care means living in a nursing home or maybe assisted living, but it also includes in-home care as well as other services. Walk Cares covers in-home care and many other services like home modifications, home delivered meals to help you live at home as you age. And we'll talk about those other services as well later on. In-home care can also support mental and emotional well-being in addition to physical support. So a 2025 study showed that home care significantly reduced people receiving care's symptoms of depression. It also improved their quality of life and lowered their risk of loneliness. So with the right support, most people with long-term care needs can keep living independently in their own homes. It's also very common for family caregivers to not realize that they are in fact a caregiver. So you might go to your mom's house a couple times a week to cook meals, maybe drive her to appointments, make sure she's taking her medications, all of which are common care activities. And the majority of this type of care is provided informally as unpaid care, usually from a family member, a friend, or a neighbor. So a program like Walk Cares is needed because the way we have paid for long-term care up until now isn't working. Even though 70% of us will need long-term care at some point in our lives, most of us can't afford it. If we look at the cost of 20 hours of home care per week at just over $23,000 for 6 months, we also know that other types of long-term care are even more expensive. But if we compare that to the median household income for Washington seniors at just $69,000 per year, right, that is a significant chunk of that household income. So family caregivers have to step in to fill that gap, and that can be either with their own savings or by providing unpaid care, as we mentioned. Almost half report a related financial setback and spend an average of 26% of their own income on care-related expenses. So a public insurance program like Walk Cares gives workers a more affordable way to pay for their long-term care needs by allowing them to contribute while they're working and their income is higher. And then they can access money to pay for the care that they need later in life when they're on a fixed income. Covering all workers also helps keep contributions low, and once they retire, those contributions stop. This approach to paying for long-term care is also more affordable than private insurance at the time when people access care. And unlike private insurance, which typically requires someone to pay out of pocket for 90 days before they can access benefits, Walk Cares has no deductible or waiting period. So to earn Walk Cares benefits, most Washington workers automatically contribute 0.58% of their paychecks during their working years. And again, they only contribute while you're working, right? So if you become unemployed or if you retire, those contributions stop. Everyone's covered at the same low rate regardless of pre-existing conditions. And starting this month, May, you'll be able to start applying for benefits. So applications are now open as of this Monday, actually. You'll need to meet a contribution requirement as well as a care needs requirement. And once approved, you get to choose how you want to use your benefits. The full benefit amount starts at $36,500 and grows with inflation. And the benefit can be used for any covered services and supports that you want. There are no out-of-pocket costs when you need care. So we pay the providers directly for the services that you receive with no copay or deductible. So this is what contributions look like over the course of someone's career. So a typical worker participating in Walk Cares earns about $59,000 a year. They pay $29 in contributions per month, which adds up to just over $10,000 total over a 30-year career. To earn less in benefits than you contribute, you'd have to make an average of $210,000 each year for 30 years. So everyone who is contributing to the Walk Cares Fund more than 500 hours per calendar year is earning benefits, and that includes part-time and temporary workers. To qualify for benefits, you have to meet the contribution requirement through one of these three pathways. So we have the permanent pathway, which will earn someone lifetime access to the full benefit amount by contributing for at least 10 years, and this is at any point in their career. Then we have the temporary pathway, which will earn someone access to the full benefit amount if they've contributed for at least 3 of the last 6 years at the time that they apply for benefits. This pathway is designed for people who have contributed recently at the point when they need care, but maybe haven't earned that permanent access quite yet. In this year, in 2026, applicants who have contributed for 3 years at any point in the program can qualify through this pathway. And then we have the transition pathway, which will earn someone permanent access to 10% of the full benefit amount for each year they contribute. And this pathway is specifically for folks who are born before 1968. So, as an example, if you contributed for 2 years, let's say, you'd earn 20% of the benefit amount, or what comes out to $7,300. So this pathway is designed for people near retirement at the time that the program launches this year and who might not be able to earn permanent access to the full amount. But these workers can also earn the full benefit amount if they qualify through one of the other two pathways. To use your benefits, we must determine that you need help with three or more activities of daily living and will continue to need help for at least 90 days. The activities that we consider are bathing, bed mobility, transferring, toileting, mobility, eating, and medication management. We'll also count any activities that you need supervision to complete. So someone, may be monitoring you or reminding you to start or keep going on an activity or helping you set up. And when you're ready to apply for benefits, you'll start by creating a Walk Care's benefits account online. If you need help managing your account, you can set up an authorized user, like a loved one or a representative as well. And you can also get help with your application from your local area agency on aging, or you can also call us to apply over the phone. And once you submit your application, we'll confirm you've met the contribution requirement. Then you'll be able to schedule an appointment to talk about your care needs. And after we've met with you, we'll let you know if you're approved to start using your benefits. Once someone has been approved, they can start using their benefits for any covered services and supports from a Walk Cares provider. So those are the full list of services that you see on the screen. You may want to choose services to help you stay in your own home. That can be in-home care, home modifications, home delivered meals, or adaptive equipment and technology. We also cover many services that support family caregivers. So you can get paid care from a loved one, even your spouse, or you can get respite care so that the caregiver can take a break. We cover education and consultation to help them manage your care, dementia and behavioral supports, and care transition coordination to support you when you leave a facility like a hospital. You can also receive services in your community, so an adult family home or adult day services, and someone can also choose to receive care in an assisted living facility or nursing home, including memory care. I do just want to highlight home modifications, specifically, of course, as it relates to today's topic. So home modifications are also known as environmental modifications, and they are changes to your home to support your health, welfare, safety, and accessibility and independence. And a contractor modifies your home to make it easier for you to cook, bathe, transition maybe between sitting, standing, and lying down, and generally move around more safely in your home. Some examples of what those home modifications can look like could be widening doorways, maybe installing a ramp, adding handrails in the bathroom, building a stair lift, replacing knobs with door handles, remodeling a bathroom to improve accessibility, adjusting heights, and then creating space under work areas for wheelchair uses. These are some other examples of really how someone could utilize their benefit. We know that about a third of people need care for a year or less. So for those people, depending on the services that they choose, Walk Cares may be able to cover all or most of the care that they need. For others, Walk Cares can provide the family with immediate relief and also time to be able to plan for future care costs. So really to focus in on the couple that may some of these examples. If you pay a family member for care, for example, you can receive care for 10 hours per week for 2 years and also get care supplies for under $35,000. If you want to make your home more accessible, as we just mentioned, to keep living there independently, you could make some of these home modifications, install a personal emergency response system, and also get meals delivered for 3 years for just over $36,000. And if someone needs short-term help, maybe after an accident, they could get in-home care for 20 hours per week for 6 months, install a ramp, and also buy safety equipment for less than $29,000. So starting in July, you can choose to continue participating in walk cares if you leave the state. So if to become an out-of-state participant, you must have contributed for at least 3 years, and also you must opt in, excuse me, must opt in within a year of leaving Washington. Just like other workers, out-of-state participants will keep contributing to the fund during their working years. And starting July 2030, out-of-state participants will be able to access their benefits outside of the state of Washington. And a couple key milestones that we want to share around program launch this year. One is that in January of this year, we began a pilot program in a few counties to test our processes. That pilot program has concluded as of end of March. Then April 1st, workers and recent retirees who have contributed can create an online account to check their annual contribution statements. That account, as I mentioned, is where folks will be able to apply for benefits as well and can apply because as of May 18th, as of Monday, applications for benefits have opened up statewide, meaning that folks can now start applying for their walkers benefit. And on July 1st is when all beneficiaries can start receiving services using their walkers benefit. So with that, I will pass it over to, I believe it's, is it Stephanie first? I forget now which order we're going in.
Oh, that's okay. This is Marcy.
Marcy, sorry about that.
Oh, don't worry about it. Thank you so much. So you can just stay on the slide for a second. I'll let you know when to transition. Thank you. So hi, I'm Marcy Getz with the Washington State Department of Health, and I'd like to thank Walk Cares for inviting me to be a part of this great panel. And also want to thank all of you for attending today and Walk Cares for the important work that they're leading. Next slide, please. So I was asked to talk about the health impacts of social isolation and loneliness. And I'm going to begin by providing some definitions of both social isolation and loneliness, as these two terms are often used interchangeably, but they do have distinct definitions. Social isolation is when a person does not have relationships or contact with others and has little to no social support. Loneliness is feeling alone or disconnected or not close to others. It's a feeling like you do not have meaningful or close relationships or a sense of belonging. It reflects the difference between a person's actual and desired level of connection. Someone can live alone and not feel lonely or socially isolated. On the other hand, someone can feel lonely while being with other people. Social isolation and loneliness are pervasive issues in our country. The Behavioral Risk Factors Surveillance System, or also known as BRFIS, is a survey that's conducted yearly throughout the United States. And when BRFIS data was looked at from the year 2022, they found that about 1 in 3 U.S. adults report feeling lonely, and about 1 in 4 U.S. adults report a lack of social and emotional support. Next slide, please. So there are risk factors related to social isolation and loneliness. Loneliness and social isolation may be shaped by conditions and the environments where people are born, live, work, learn, worship, and play. These conditions can affect the ability to connect socially. Certain conditions or experiences may increase a person's risk of social isolation and loneliness. And some examples of individual risk factors are, and they're also listed on the screen here, but it may be that someone has a mental health or physical challenge. They may have a chronic disease or some sort of condition that impacts them physically. They may have some sort of mental health or psychiatric condition. Someone may be struggling from a long-term disability. Another risk factor is being marginalized or discriminated against, and also having limited, I'm sorry, or no access to resources, such as someone may be living in a rural area. They may have limited or no transportation, and they may experience language barriers, as well as other things listed up here, including facing major life events where there's loss involved. Loneliness also may impact some groups more than others. And like I have on the slide here, it may be impacting you more if you have less income, if you are living on less, or maybe if you're an older adult, or you live alone, or you're new to this country, or you're a part of a group such as the two-spirit, lesbian, gay, bisexual, transgender, queer, or questioning, intersect, asexual, or plus group. Those groups tend to have more experiences of loneliness and social isolation. Next slide, please. So there are impacts, and Dr. Murthy is his name, and he was the 19th and 21st Surgeon General of the United States under the Obama and then Biden administrations. And I have a quote from him, and I think it's powerful. He said, "Loneliness is far more than just a bad feeling. It harms both individual and societal health. It's associated with greater risk of cardiovascular disease, dementia, stroke, depression, anxiety, and premature death. The mortality impact of being socially disconnected is similar to that caused by smoking up to 15 cigarettes a day, and even greater than associated with obesity and physical inactivity. Chronic social isolation and loneliness increase the risk of premature death, or it can increase it by 26%. Next slide, please. So I have some good news. After sharing some of the heavier information, is that there are things that we can do for ourselves and others when we're experiencing social isolation or loneliness. DOH has a campaign titled findyourpeople.org, and it's an interactive, no-cost campaign for older adults. Friendships and connection can be harder to find as we age, and this helps you find ways to connect with people of all ages. Social connection looks different for everyone, but the benefits are often the same. And I will be in the next few slides sharing resources, and when I'm done, I will put links into the chat. Another really important opportunity is volunteering. You'll hear later from my colleague from AARP, and they have some great opportunities to volunteer as well as other organizations throughout our state. And what they find with volunteering is that there's a beneficial relationship, is reciprocal, and study after study tout the benefits of volunteering. They point to an increase in brain function, a decrease in blood pressure, less depression, and more social engagement. Some benefits are more abstract, but are just as important. People who volunteer often report a new sense of purpose that may be lost after retirement. Often people revive old passions or develop new ones. They also enjoy connecting with generations other than their own. Also, I have other things listed on here, for example, senior centers, art and wellness programs, becoming a dementia friend, which again, I'll put a link in the chat, starting a memory cafe, reaching out to family and friends, trying a new activity. And it's really important to know that even a small step can help you or someone else who's struggling with social isolation and loneliness. Next slide, please. So another piece to addressing loneliness and social isolation is countering ageism. And I really encourage you to check out this organization. And again, I will also put it in the chat, called the National Center for Reframing Aging. And ageism is discrimination or unjust treatment of older people based on stereotypes. And they have some wonderful handouts and ideas about how we can change how we talk about aging and also our own internalized stereotypes. Oftentimes, internalized stereotypes form over years of hearing messages that may be inaccurate. Next slide, please. So here's the good news, I think, is that another powerful message is that positive self-perceptions of aging can extend life expectancy by an average of 7.5 years. So it really makes the case for rethinking how we think about aging. Next slide, please. Here's my contact information. Feel free to reach out. And again, I'll put those links in the chat. Thank you.
Thank you, Marcy. And with that, I will pass it over to Stephanie. Sorry about that.
All right, can everybody hear me?
I'm hearing an echo on my end, at least.
Yeah, I hear some echoes. All right, are we all good now?
That's good. Yeah.
Okay, great. All right, so I'm Stephanie Knold. I'm with the Department of Health. I am the Older Adult Falls Prevention Specialist, and today I'm going to talk about older adult falls. I'll be talking about some data for Washington State first, and then go on to some fall prevention efforts, and then talk about our evidence-based fall prevention program, SAIL. Next slide, please.
And Stephanie, just a reminder, we do have for the interpreters just to uh, keep it at a pace for them to be able to keep up as well. So I just saw
Got it.
a reminder in the chat, so just sharing that helps.
Okay, thanks for letting me know.
Yeah.
So first off, about Washington State's population. As we all know, we have a very fast growing aging population. In 2020, there were over 1.25 million people over the age of 65. That's about 16% of the population. By 2050, this is going to expect to raise to over 2.3 million, which will be 23% of the population. This is the fastest growth that expected to occur before 2030. The most rapid shift in our aging population is 85 and over. This population's expected to increase more than 4 times from 2020 to 2050. Next slide. The cost of unintentional fall-related injury deaths is a lot to our state. This is from 2023. It's 3.46 billion and then 46.85 million in medical costs, whereas it's 3.41 billion in value of statistical life. Next slide. Here we're going to talk about fall-related deaths from 2010 to 2025. And if you look at the green line, that's the United States. The blue line is Washington State. The rate of fall-related deaths among adults 65 and older has been higher than national rates for over the past 10 years. The rate was highest in 2021 and decreased by 9% in 2023. In 2023, Washington State had the 17th highest rate of older adult falls deaths in the country. Based on preliminary data for 2024, it has decreased significantly to 2023. So that we have some good news. It looks like we have decreased some. The data comes out delayed. So this is preliminary data that you see in the bar graph on the right side. Next slide, please. This is just a quick overview of our state so you can see what county you live in. The green line is statewide, whereas Whitman County is at the top of the bar graph, showing that they've had the highest rate of fall-related deaths in the state. And next slide. Here we have fall-related deaths by age groups, and this is really significant because if you look at our aging population, which is the gray line at the top, and then the green line is from 75 to 84, the blue line at the bottom is 65 to 74. So you can see the huge jump in fall-related deaths in the 85 and over population, and then you can see the actual numbers in the bar chart on the right. So this is why it's really important that we learn early to be able to stay safe and in home, as well as maintain everything we need to, which I will cover a little bit more in a little bit. Next slide, please. So this is by fall-related deaths by location. So as you can see, the biggest piece of the pie is 65%. This is happening in people's homes. So in your family home, their own home, and then down to 23% happens in the nursing homes and assisted living facilities. So this is why we talk about aging in place is so significant, because the majority of falls are happening in the descendant's home. Next slide, please. Here we have the types of falls. So you can see at 80%, we have falling in the shower, off the toilet, or bumping against objects. So this is happening in the home. Majority of falls are happening in the bathroom. So this is why it's super important that we make sure our homes are safe, especially in the bathroom. And then you can just see the different causes of falls from there. Next slide, please. So now we're going to talk about common risk factors for falls. So you can see on the left the modifiable risk factors and non-modifiable. And I'm not going to go into depth over each one, but the more risk factors you have, you're going to have an increased risk for falls. So make sure that on the left, the modifiable risk factors, that you get your vision checked, you get your hearing checked, you maintain gait strength. Medications is huge, making sure your medications are on par. Home safety, home modifications. Foot issues, making sure you're wearing the appropriate footwear. Vitamin D deficiency is one, and then other comorbidities. Next slide, please. Here is just a simple tool, and I'll put the link to this in the chat, where you can actually take a fall risk assessment on your own. It's something really important to do to kind of see where you are at your current state. And then if it's something that you find out that you might be at risk for a fall, you can print this out and then take it to your physician and go over the different things that you can do to help improve your risk for not falling. Next slide, please. So there are 6 steps to prevent a fall. I'm not going to go over all of these today, but I will go over finding a good balance and exercise program by telling you about our SAIL program, which is Stay Active and Independent for Life. But first, finding that good exercise program, talk to your healthcare provider about falls, review your medications with your healthcare provider, get your hearing and vision checked, keep your home safe, talk to your friends and family about support. So having that conversation is very important, so everybody's on the same page. Next slide, please. So we're going to talk a little bit about exercise. The goal is to move more and sit less. So the goal is 150 minutes a week of moderate activity, such as brisk walking. This does not have to be 5 days a week of 30 minutes back-to-back exercise. It can be exercise snacks, I like to call it, where you're doing a little 10-minute brisk walk here or 10-minute activity there, adding up so you're totaling 150 minutes a week. So try not to make it too difficult on yourselves, just trying to fit that time in. And then at least 2 days a week of strengthening exercise. As we age, our muscles atrophy, they disappear. And so it's really important to maintain our strength to help prevent falls. And then again, doing activities to help improve balance, such as just standing on one foot and trying to implement those into your activity as many days a week as you can. Next slide, please. So I'm going to talk about evidence-based programs. The reason they're important is because they've been designed and tested for older adults. They've actually have proven outcomes. They align with best practices and quality initiatives, and they support regulatory and funding expectations. Next slide, please. So Stay Active and Independent for Life is a program that we oversee at the Department of Health. It's an evidence-based exercise program for those 65 and over. It focuses on strength, balance, and fitness, and it's recognized by the Administrative for Community Living. Next slide, please. So SAIL is much more than just exercise. We have fitness checks at the very beginning to see where you are. It has an evaluation tool of the class. Every participant gets a SAIL guide. You're ready for exercise to make sure you can return to exercise after physical therapy or if you've had an injury. It has a self-assessment tool. It also has a fall risk assessment. And then we have ongoing fitness checks. That's objective testing. So checking your balance throughout every 3 to 6 months, as long as you're in the program. Next slide, please. SAIL is structured to be a group exercise class. It's usually about 1 hour, preferably 2 to 3 times per week. It consists of a warm-up, cardio, balance, strength, stretching, and always included an educational component. So the instructor will bring a new informational component where the participants learn, usually something on fall prevention. There is an ongoing format or a long-term format. And next slide. So the great thing about the SAIL program is it can be done in assisted living facilities. It can be done in senior centers. It can be done anywhere that somebody wants to host a SAIL class. Exercise is modifiable for anybody. So it can be seated or standing depending on your fitness level. It's appropriate for varying functional levels. It's safe for residents with chronic conditions. And it is inclusive and scalable. And next slide. The evidence behind the SAIL program, its randomized controlled trial foundation was done back in the early 2006, I believe, and it demonstrated improvements in strength, balance, mobility, and it showed reduction in fall risk factors. Okay, next slide. Thank you. So the outcomes were improved mobility to perform daily activities, increased confidence with movement, maintenance of independence, and enhanced overall quality of life. Next slide. So going back to Marcy's presentation on social isolation, the other thing that's great about our group exercise SAIL classes is it's increased engagement and routine. It reduces isolation and it has a positive impact on mental well-being. Participants seem to all connect, check in with one another, they make new friendships, and they genuinely care about one another. Next slide, please. The operational benefits for facilities is no licensing fee, it's public domain, it's predictable scheduling, so it's easy to schedule, delivered by trained and certified instructors that we make sure stay up to date with their certification by taking recertifications, and it integrates existing wellness and or restorative care. Next slide, please. So sale fits community dwelling, assisted living, and skilled nursing. It supports higher acuity residents. It's standardized, consistent program delivery, complements therapy and restorative nursing, and supports interdisciplinary care goals. And next slide. Falls are a major driver of injury and decline. SAIL targets modifiable fall risk factors. It's a proactive approach to residential safety and supports quality improvement initiatives. Next slide. So the great thing about SAIL becomes part of your daily life. It encourages active aging. It reinforces dignity and independence. It shifts the focus from reaction to prevention. Next slide, please. So your key takeaways here is exercise works, but program choice matters. But the main thing is making sure that you do choose exercise. Any type of exercise is better than no exercise. SAIL is proven, adaptable, and sustainable. It supports residents and facility goals, and its evidence translated into real world impact. And next slide. So I will put some links into the chat. That is all for me. I'll be happy to answer any questions at the end of the panel discussions. And thank you for your time. I appreciate it.
Thank you, Stephanie.
Thank you.
And next up, we'll pass it over to Christina from AARP.
Great. Thank you so much. And thank you for having me today. I'm so glad to be able to talk to everyone. Next slide, please. I'm going to talk about a couple of things today. Mostly I wanted to focus on a program called the Senior Property Tax Exemption Program, which I like to say is the state's best kept secret, which maybe isn't the best thing, because it really is a robust program that can help reduce property taxes. And I want to end today with just a couple of free resources that are available for Washington's 1.2 million unpaid family caregivers. So you know that this important journey does not have to go alone and by yourself. Next slide, please. So why does property taxes matter for older adults? Well, even if you've paid your mortgage, property taxes can keep going up. And when home values rise, those property taxes go up as well. So for someone who's on Social Security or a modest fixed income, a big tax increase can be a real strain. So that's why Washington's Senior Property Tax Exemption Program exists, to help seniors, people with disabilities, and certain veterans keep their homes affordable as they age. Next slide. So the program itself is for people who own and live in their own home. So it is about your primary residence. For older adults, there is an age base. So you need to be 61 or older by December 31st of the year that you apply to be part of the program. You could also be retired due to a disability, or you could be a veteran with a service-related disability, and those qualify at any age. There is no age limit for those programs. To qualify for the program, your income needs to be below the county median income limit. And that is how you end up qualifying, and it is by county. So if you live in a higher cost of living county, like maybe King County, the income level requirements are higher than in maybe a more rural county like Yakima. Next slide. So the way the property tax relief works is if you are approved for the program, you get a partial exemption, which means part of your home's value isn't taxed at all. You also get what we call a valuation freeze. So once you're in the program, your taxable value of your home is locked in. So even if your home's market value goes up, your property taxes won't. They will remain being calculated at the year that you qualified for the program. So essentially, it stabilizes your property taxes and it can significantly lower what you owe each year, making it easier to afford to stay in your home. AARP did work on some legislation this year to make the program a little bit more robust. We got quite a bit of feedback that the application process was rather difficult. You had to pull in a lot of information about your income and medical expenses. And so we passed a law this year that goes into effect on June 10th. And it now implements a standardized deduction to help the paperwork be a little less onerous. So there's now a $7,500 standard deduction for single filers and a $15,000 standard deduction for couples. And it is important to note that this is based on the entire household income. So it is based on the income combined of the people that do live within the home. We also recognize that in order to make a little bit of money, some older adults will rent a home out in their place. And so this year, the new law also exempts up to $6,000 of rental income that won't go against the income limit to qualify for the program. And then we also expanded the program to benefit more veterans. Prior to this year, your service disability had to be 80% or higher, but with the new law, now the service disability is 40% or higher. So this expands to, we're estimating about another 30,000 homeowners within the state of Washington. And so more relief for folks out there. Next slide, please. So I just wanted to throw out some of the income levels. I think a lot of folks either don't know that this program exists or think that their income levels might be too high to qualify. And so I just wanted to give some examples of what the qualifying income levels are. So this is within King County, the current program. You can qualify at $84,000 or less. And then the next year for 2027, it jumps up to $100,000 or less. And then I just put a couple of other examples in here of other counties across the state, just to get an idea of what the income levels are that might qualify for the program. Next slide, please. So the only downside to this program is it's not automatic. Unfortunately, you do need to apply. They are administered by your county assessor's office. So your county assessor is the organization that you would contact to learn a little bit more about the program and to get the forms to apply. If you have looked into this program in the past and you maybe didn't qualify in the past, it's worth checking in again. Because of the expansion of the program, more people will qualify. And I also want folks to tell their friends. I will say one thing that we do get at AARP a lot is county assessors will come to us to help raise awareness of the program. And so we do notify our members usually a couple of times a year that the senior property tax exemption program is something that is available. So it is definitely worth looking into to lower the property tax burden and help you stay within your own home. Next slide, please. And so now I want to transition a little bit to resources for family caregivers. We had mentioned Marcy, I think, and Sebastian at the top of this presentation is that a lot of people don't know that they are a family caregiver. They're doing small tasks. They're taking their loved one to a doctor's appointment or helping them get groceries. That means you're a caregiver, and there are resources out there available to you, and many of them are available through the Area Agencies on Aging, which serves all 39 counties within Washington State. And they really are kind of the first door to open, the first phone to call. Next slide, please. The family caregiver program and some of the resources out there that are available can help you learn how to give shots, can help you learn how to transfer a loved one. They can help connect you with programs that can provide relief for the family caregivers so they can rest and relax. And then there's a lot of training that is available, and you don't need to know anything. All you really need to know is the phone number to call, which is the next slide. And so there is a program called Community Living Connections, and it is staffed by experts. All you have to do is call the number on the screen, 855-567-0252. They will ask you some questions about your situation, and they will help connect you to resources within your community. And they're often connecting you to programs that you may not have even known existed or that you qualified for. AARP also has a toll-free number that you can call if you just need some support, if you want to have someone lend an ear. And then we also have some resources for family caregivers along on our website as well, which mimics quite a bit of what you would find through the Community Living Connections. Next slide, please. So key takeaways. There's property tax relief out there. We've expanded the program. It could help lower your tax burden. Contact your county assessor's office to get more information to see if you're eligible. Caregivers, you don't have to do it alone. There are resources out there that can help you do this labor of love. And if you just do one phone number, call Community Living Connections, talk to an expert, they can help you connect with resources within your community, and tell your friends and family that these resources are available. Thank you.
Thank you, Christina. All right, I know we are coming up to time here, but open up a few minutes for questions. I don't see any in the Q&A function currently, so if you do have a question, we have a couple minutes to put in there and answer your question. I'll give folks a few seconds here to see if anything comes through. Oh, looks like not sure which slide, Carol, but I'm assuming it's the maybe the slide with the phone numbers. The slides will also be posted on our website, wildcaresfund.wa.gov/webinar, so you'll be able to write down any phone numbers or other information in by viewing our downloaded slides as well. So. All right, I'm not seeing anything else come through. All right, so I want to thank you all again. As I mentioned, the slides will be available on our website, and the recording to the webinar as well will be posted on our website. And also want to thank our panelists for joining us today and sharing some great information. So thanks everyone for joining, and we will see you next time.
Thank you.
And I just realized we do have a survey before we close out. We have a survey that will be appearing on your screen. So if you could take a couple minutes to take the survey, let us know your experience and any feedback you have. And that would be great. We'd appreciate that. Again, the links to our website and our social media platforms. And with that, that'll wrap us up. So thank you all. Have a great rest of your day.